Welcome to Medicoria. In today's video, we shall be talking about pelvic inflammatory disease, abbreviated as PID. I'll be explaining briefly what PID is, what causes it, the risk factors, some of the signs and symptoms that one might experience if they have PID, some of the treatment options available if you have PID, and lastly, I'll cover the prevention of pelvic inflammatory disease. Pelvic inflammatory disease refers to an infection of the female reproductive system, an infection that involves the upper portion of the female reproductive system, that is to say the upper portion of the uterus, the fallopian tubes and the ovaries. Sometimes in case the infection is very severe, it can spill out of the reproductive system into the pelvis and also sometimes the abdomen, and can cause a more generalized infection in such severe cases. Pelvic inflammatory disease is usually caused by bacteria, but on rare occasions it can also be caused by parasites and some viruses. Majority of the bacteria that cause pelvic inflammatory disease are the sexually transmitted infections, especially gonorrhea and chlamydia. This especially happens if you've been having these infections for long periods of time without treating them. This happens because some people actually have these infections and they do not have any symptoms at all, so they do not actually know that they have these infections. So when they go untreated for a very long period of time, it causes you pelvic inflammatory disease. Other bacteria that are not sexually transmitted can also cause pelvic inflammatory disease on rare occasions. This includes bacteria that are normally found in the vagina of a female, known as the normal flora. If these find their way up through the cervix into the uterus, then you could develop pelvic inflammatory disease. On rare occasions also, you could have bacteria coming in from the gut. That results from cross-contamination between the anus and the vagina. If these also find their way up, they can cause you pelvic inflammatory disease. Under normal circumstances, the uterus is usually free from all these infectious organisms because the body has got mechanisms in place to prevent ascent of infection or germs from the vagina through the cervix into the uterus. This mostly rotates around the cervix. Most of the time the cervix is closed and it secretes a thick plug of mucus that prevents this bacteria from crossing. The cervix also has some mechanisms. It contains some cells that play some roles in immunity, in killing some of the few that try to get their way up. But there are certain situations in which these mechanisms are impaired. Some of these happen naturally in a woman. For example, during menstruation, the cervix has to open to let all of that blood flow out. Also, when a woman is giving birth, the cervix has to open to allow the baby to come out. Likewise, in a woman who is having a miscarriage, the cervix has to open to allow all those things inside the uterus to come out. Sometimes the cervix can also be opened by a doctor in a hospital when they're doing some procedures that involve, opening the cervix and getting access into the uterus. For example, maybe removing retained products of conception after maybe an abortion or something like that. And in the event that that doctor does not observe a very clean technique while doing that, sometimes he can end up introducing infection into your uterus. Also, during the menstrual cycle, there are times when the mucus plug that I talked about gets thin. This usually happens around the time when a woman has ovulated. This happens to facilitate fertilization, to make it easy for the sperm that has been deposited in the vagina to pass through the cervix and find its way up in the uterus such that fertilization can take place. So around these times when the cervix is open or the mucus is thin, if there is an infection, it can easily find its way into the uterus and cause problems. Sometimes these mechanisms can also be disturbed when someone has some abnormalities in the vagina. For example, if you have maybe bacterial vaginosis or a sexually transmitted infection or cervicitis, that injury to the vagina and cervix also weakens those defenses and makes it easier for these organisms to pass and find their way up into the upper portion of the reproductive tract. That being said, let's look into some of the factors that may increase the risk that a woman may develop pelvic inflammatory disease. The very first risk factor being a female who is menstruating, that is past puberty, but less than 25 years of age. You are at a higher risk of developing PID than a woman who is more than 25 years of age. Doesn't mean they don't develop it, but it is more common among women younger than 25 years of age and menstruating. The risk is even worse if you are a sexually active female, and even worse if you have multiple sexual partners, or perhaps you might be having one sexual partner, but this sexual partner connects you to a broad sexual network. Your boyfriend or husband perhaps interacts with several other women. You are also at risk of getting pelvic inflammatory disease. If you've recently had a miscarriage, you are also at the risk of developing pelvic inflammatory disease. There is also a minor risk of developing pelvic inflammatory disease after inserting an IUD. That happens if the person inserting an IUD does not follow the proper aseptic technique while inserting it. There's also one practice that a lot of women do out there. They do what they call douching. Douching is the practice of using certain solutions. Some of them are sold commercially, whereas others are prepared at home to try to clean out the vagina. They are flushed up into the vagina. In that attempt to try to clean up the vagina, you actually end up messing the balance of things up there, and you increase the risk of getting pelvic inflammatory disease. There have been several studies that have shown that this is very true. So therefore, you should know that your vagina is a big girl. She knows how to clean herself. She doesn't need your help to get clean. Most of the time, you just need to wash the outside part, the vulva, but don't try to get inside and clean it. It usually has a way it cleans itself. So what are some of the symptoms that one might experience if they have pelvic inflammatory disease? First and foremost, some people might have pelvic inflammatory disease and show no symptoms at all. In other words, usually this happens if there is mild inflammation, but then the symptoms are not really that outblown. So you have disease ongoing, but you don't show any symptoms. Other people might show mild symptoms, very few symptoms, whereas others might show many symptoms and sometimes very severe symptoms. So some of these symptoms include lower abdominal pain. So this pain usually is from your navel downwards. Some people call it the belly button. And the pain tends to be a crampy kind of pain. Sometimes it's just dull and aching kind of pain. And in some people, it tends to tie around the menstrual periods. It can maybe start coming towards your menstrual periods, or during the menstrual periods, or sometimes shortly after your menstrual periods. And you might end up confusing that with cramps. So you need to be aware of how your menstrual flow usually comes, so that you can notice a difference. Pelvic inflammatory disease can also come with abdominal vaginal discharge. So this may be an increase in the amount of discharge that comes out of your vagina, or the discharge could change color, or the smell of the discharge could change and become a little bit offensive. Other women experience abnormal vaginal bleeding. This could be in the form of spotting in between your menstrual periods. You're bleeding when you're not in your menses, or sometimes it could also get superimposed with your menses and you fail to differentiate. But then usually you might notice an increased flow of blood, and sometimes the blood might be altered a little bit in terms of smell or sometimes color. Pelvic inflammatory disease can on rare occasions also present with burning urination. Other women experience difficulties while having sexual intercourse, particularly penetrative sex. You might experience this kind of pain during penetration, and sometimes also maybe just after sex you notice that some blood has come out. There are also other unspecific symptoms of pelvic inflammatory disease. You might have this fever. Sometimes you might have headache. Sometimes you just feel generally sick, something that is known as malaise. You feel sick, you don't feel fine. Sometimes you have nausea, that is a feeling that you want to vomit, or sometimes actual vomiting. PID can also get so severe in the sense that if it has spilled into your pelvis or into your abdomen, you could also get other symptoms. For example, you might get a pain that is localized in the upper right portion of your abdomen. That usually means that the capsule of your liver has also gotten involved in the disease. Or sometimes you could have generalized abdominal pain. When PID has progressed, it comes with some complications, especially if it goes untreated for long. One of the commonest complications is infertility. So you might experience difficulties getting pregnant and having children. The second one could be chronic pelvic pain. Chronic pelvic pain happens even after you've been treated and you've recovered from pelvic inflammatory disease, and then this pain stays with you even thereafter. It usually results from formation of scars. If the inflammation is so intense, some scars form and cause you that pain. In the medical world, they are known as adhesions. The other complication of pelvic inflammatory disease is an increased risk of ectopic pregnancy. In that, when you get pregnant later on, sometimes it becomes difficult for the fertilized egg to move all the way into the uterus to implant. So it ends up implanting outside the uterus, maybe in your fallopian tubes, in your ovaries, in the abdomen, or somewhere else, in the pelvic cavity. So that being said, what are some of the actions that you can take in case you have one or more of the symptoms? First and foremost, I need us to recognize that not all women with PID experience these symptoms, and not every woman gets a similar pattern of symptoms. It varies. And also the second thing to note is that there are also other conditions that present with similar symptoms to PID. So do not diagnose yourself at home and do not medicate yourself. Once you suspect yourself to be having PID, do reach out to your healthcare provider and talk about it. In case a diagnosis of pelvic inflammatory disease has been confirmed, there are different treatment options that you can undertake. First, you can be treated in the outpatient department. That simply means you might be, after confirming the diagnosis, you're given medication, basically antibiotics, and then you go home and take your medications from home until you get fine. However, if the infection is severe, you might have to be admitted in a hospital and be treated with medications which are injected through your veins, that is intravenous treatment. In case situations also warrant, there might also be need for surgery, especially if there is an abscess. That means a pocket of pus has formed inside, your pelvis or somewhere, or some other complication that warrant a surgery. Sometimes you may get operated for pelvic inflammatory disease. So to make sure that you do not develop pelvic inflammatory disease, you need to take the following course of action to prevent it. One is to avoid unsafe sex. Whenever you're engaging in sexual intercourse, use protection, for example, condoms. Try to be faithful to your partner. Do not engage in sexual activity with a lot of sexual partners. And also try to avoid sexual activity around these periods that I've talked about, where your cervix is open or where the mucus has thinned out, especially sex that leads to an orgasm, because whenever there's an orgasm, there are contractions that facilitate the movement of whatever is in the vagina up through the cervix into the uterus. I also encourage women out there to screen regularly for sexually transmitted infections, because like I mentioned earlier, you could be having these infections but show no symptoms at all, and when they go untreated, they cause you PID and its complications. So you need to take different courses of action to prevent PID. In case you have symptoms, reach out to your healthcare provider and get treated early, such that you do not develop any of the complications I've already listed. Otherwise, thank you so much for watching the video. In case you feel I've left something out, do drop it in the comment box below. If you have any further questions concerning PID or any other health concern, also feel free to leave it down in the comment box or to email us at medicoria@gmail.com. In case you enjoyed the video, don't forget to like it. And if you don't want to miss out on similar videos in the future, do subscribe to the channel by clicking the link on your screen or the subscription button down below. And don't forget to turn on your notifications. Thank you so much for watching till the end. See you next time.